So in prevention, we always talk about going up the river and pulling people, or going up the river and preventing people from falling in the river versus standing on the side and pulling people after they've already fallen. Once they're in the river, they're wet, they're heavy, it's harder to get them out of the river than if we went upstream and prevented them from getting in to begin with. So Raleigh County United for Prevention, we're a community coalition. If you're unfamiliar with the work of a coalition, it's a collaborative group of people that working together to address a community issue. So in this instance, our community issue is youth substance use prevention. We've been around since about 2016, been a nonprofit since 2020, and it's been just a revolving door of people in this community who want to do something about our opioid crisis, our substance use crisis. And so our mission is, through collaboration, education, and early prevention, we support healthy development and create stronger foundations for families, neighborhoods, and future generations. We have more than 12 community sectors who are at our table, who are working on this. Being at the table means different things for different sectors. We have like a policy committee, we have a fundraising team, we have a evidence-based, like a strategic team. We have people who help us with our youth drop-in center, and who are law enforcement officers who help us with our compliance checks. We completed the National Coalition Academy in 2023. I have my MSW from Concord University, and the National Coalition Academy was more intense and made me cry more often than getting my master's degree did. So it was very intense. We had to work through evaluating community readiness, the community assessment of what the community already has, what the community needs, who is willing and ready to address that. So one of the things I think we can all agree on is bringing new things into the community is very difficult. People fear change. So we might need something as a community, but that doesn't mean we're ready to address it. So part of the Coalition Academy was evaluating how ready Raleigh County was to address prevention, as well as addressing who is at the table, who needs to be at the table, and how do we get them there. So we are a Drug-Free Communities recipient. The Drug-Free Communities program is through the Centers for Disease Control and Prevention. It requires that we have at least these 12 sectors at the table, but we have others who are involved in some capacity. But our board is made up of at least one member from each of these 12. We do not have, some folks overlap, like we have a parent who's also a business rep, but they don't serve both capacities. So there's 12 members, they all are at the table, provide input, and it helps us, or prevents us from getting involved in like a good idea fairy of, oh, let's go do this because it sounds like fun, that it's strategic. It's collaborative. The coalition approach comes from the Icelandic model. So in Iceland, in the 90s, had a huge substance use problem. And they came together and how do we prevent this? How do we save our kids from engaging in substance use? And so outcomes of that is the coalition approach. Everybody in the community is affected by this somehow, some way. So they came together and they collected a lot of data about who is engaged, why they're engaged, what are the risk factors, where can they increase support to protective factors. And so over a 10-year period, Iceland saw a huge reduction in their kids engaging in substance use, which ultimately leads to productive workforce, economic development. So tracking that data along through the 90s and everybody being on the same page, no matter which sector you're on, that we're working through this strategically, proved to be like evidence-based effective approach. So what is prevention? So we get this a lot. There's a lot of confusion around what prevention is and what prevention's not, especially as all the different communities are talking about the disbursement of their opioid funding. So I've had people tell me before that Narcan prevents people from dying, and that is true, but that is not substance use prevention work. That falls under treatment on our continuum of care. Prevention work is strategic. So if I have a kid engaged in an activity and that is preventing them from engaging in substance use, it's really hard to capture that is the reason why that kid is not engaged in substance use, right? So that is why having overall community data and watching the trends as a community is important, because you can't really capture what prevents somebody from doing something without asking 10,000 kids individually of why you're not doing something. There's a language of substance use versus substance misuse. A lot of folks are talking about preventing kids from engaging in substance misuse. We don't want kids to use it at all. It is misuse for all kids to be using vaping, alcohol, marijuana, whatever it is, because they're not supposed to be doing that, right? So if you talk about misuse versus use, then that implies that kids can use it as long as they're not misusing it, right? As long as they're not intoxicated, they're just having one or two drinks, then it's not misuse. So making sure that our community language is that we don't want kids using substances at all. And there's 3 types of prevention. We have indicated, selective, and universal. So addressing prevention at an overall level, a universal. So most of our approach is for Raleigh County, right? So that would be a universal approach. It doesn't matter which kids are at risk, which groups, boys, girls, need more attention. Our prevention efforts are for Raleigh County. You get into selective of subpopulations. So if data comes out that all 7th graders are struggling with vaping in school, and we target our efforts towards 7th graders, that's selective. And then indicated is if we put our efforts towards all the kids who are having behavior issues in schools, then that is indicated. All other substance use, treatment, recovery, even providing food to specific adults, homelessness, that is all fine. That falls under treatment and recovery versus prevention. And there's a whole certification process for prevention sciences. So when we get into, oh, this is prevention, because it's preventing somebody from dying, yes, that's technically the term, but as far as the continuum of care follows, there's certain criteria for prevention work. So prevention action plan, I just went on a whole thing about how it's hard to capture how we know if something we're doing is preventing kids from engaging in substance use. So we follow the strategic prevention framework, which they just talked to kind of about having this process and grant applications. And we use it as a framework for just all of our work. Some of our work doesn't require funding requests directly, but it really, it helps us evaluate what is needed, who can do it, are we ready to address it, is it going to get done? Because we all have a bunch of people who are good idea fairies, and then once the idea is played, we never see anybody at implementation. So is somebody gonna follow through? And an evaluation team, was this effective? Did it have the impact that we needed for it, for us to continue doing it, or do we need to expand on it? And so in prevention, most prevention coalitions across the state of West Virginia and across the country, we follow the 7 strategies of community level change. And the reason for this is if we focus on individual strategies, so providing information, building skills, or providing social support, but our environment allows for this to take place. So if we tell kids, don't go out and vape, don't drink, and then everybody's drinking in the streets, then we have not set up an environment that enforces what we're teaching them or what we're talking to them about. So we're telling them it's unhealthy, and then we're going out and doing the same thing, or our policies don't regulate those things, then we're up the creek without a paddle. You know, we're not evenly spaced there. And so the same thing with environmental policies. So if we focus all on the environment stuff, and then we don't teach our kids the healthy boundaries, then they're like, why are we doing this? Why is this policy in place? But we haven't done the education piece. So they go hand in hand. We need each one just as much as we need the other one. So this is just not for funding requests. This is a framework. And we did it for our drug-free communities proposal, but it's a framework for everything that we do. And we have a logic model that we follow, so when everybody's like, oh, we should do X, Y, and Z, that's a great idea. Let's walk through that. How do we know that we need to do that? Do we have the capacity to do it? And who is going to do it, and who's going to make sure that we are doing it well? So data in the driver's seat. So this is where we get into our youth survey. So part of our drug-free communities requirements is that we evaluate 16 measures for vaping and tobacco, marijuana, alcohol, and prescription medication not prescribed to the children. And so we have a prevention saying that nothing for youth without youth. And so we, as adults, can't sit around and make decisions for our kids. We think we know what is best, and for the most part, we kind of have an idea, but this is their community. They are the futures of our community and what's going to be sustainable. So if we're deciding for them, and then we all move on, they're left to pick that up. And they might not like how we've done it, or don't have the same ideas that we do. So having their input in their community also helps them have their buy-in, right? So we're required to have these 16 measures of the last 30-day use. So have they used whichever of these substances in the last 30 days? Their perception of harm, do they think that this substance is bad for them? Do they understand the health implications? Their perception of parental approval, do they think their parents would be upset if they found out they were using any of these substances? And their perception of peer approval. So is their friend group going to be upset if they found this out? We added a couple of other measures to kind of get to the root of, so if the kids told us, yeah, we're vaping, can we get to the root of why that is? In 2023, we did a survey. We had about 200 responses from each of the middle schools and each of the high schools. The percentages were kind of skewed because we have almost 6,000 middle school and high school students between public and private schools. So we use that as our foundational data to achieve more funding. But it came back, we talked about in the last presentation, when we do our evaluation of that was data we needed more responses from. So in this 2025 survey, we'd had more participation. We had about 40% of our middle school and high school students in the county participate. And if you've ever done sample population survey things, 40% is a really good outcome for what we have. And we had 8 out of 9 schools participate. We had one school who chose just not to participate at all. We did this in partnership with County Commission. They provided opioid funds for us to incentivize schools, and they were allowed to use that. We had one school use it for project graduation. We had one school use it to provide like resources, direct basic needs to their students. So they were able to do that. We were able to get responses so that we can start having these conversations as a community. Prevention has been around for a while, but when we talk about community readiness, I feel like I've had this conversation many, many, many times with even the folks in this room, and we learn something new every time. So as we work towards community readiness, having this data of what the issues are and where we go to is important. So these are the responses. So we have the biggest takeaway to take from this data is that most of our kids in middle school and high school are not using substances. So we have about 11% who have admitted to having between 1 and 5 drinks of alcohol in the last 30 days. We have 12% of our kids who have admitted to using a vape between 1 and 5 days, 9% using marijuana, and 8% using prescription medications not prescribed to them. I think one thing that I want to note is that within our community, we hear opioid crisis, the opioid crisis. Everybody's talking about Oxycontin and the different opioids and how that has affected our community. And so because that is a constant conversation that we are having amongst each other with our kids, that the percentages are different for prescription medications that are not prescribed to us versus the other substances. So that's a solid point of continuing to have these conversations, being consistent, being annoying about our message so that we get it across. So the difference between parental approval. So most of our parents, because I hear this all the time of parents needing to raise their children to do X, Y, and Z. Most of their parents are not going to approve of their kids using substances. So I think that that's our main takeaway of this. This is not a norm. Our kids need to hear that most kids are not participating in this. So when they have conversations of everybody's doing it, no, they're not. We need to reinforce that message that not everybody is doing it, not everybody's parents think it's okay, and most friend groups do not think this is okay. So in addition to this survey, we did a focus group with our teens. And one of the things that sticks with me the most is that one of the kids looked at me and said that adults use alcohol to celebrate everything in this community. So it's at every event, so they glorify it. It's a community norm. So we as a community have communicated to these kids that alcohol helps us relax. It's a social thing. So they're watching and they see that. So when we have events that are family friendly, there needs to be a way to isolate that or communicate to our kids that that is not a community norm. And in prevention world, we can't teach moderation, which is what most adults tell me when I tell them that, is that I'm an adult of age and I know how to moderate my intake of alcohol. We can't teach that to kids because goes back to our conversation of substance use versus misuse. And the other takeaway from our focus group was all of the kids in the room could tell us where they could leave and go get alcohol, vapes, marijuana right now without an adult helping them do that. They could just walk in somewhere and they could access it. So community access is an issue in this community. And we see all kinds of posts on Facebook about this, that, and the other vape shop of who can get where. So we're all kind of familiar with where the access is coming from. So another thing that I hear in prevention world is kids don't have anything to do. And I see it on Facebook. There's nothing to do. So part of our survey is that we took an evaluation of what kids are doing with their out-of-school time. And only 18% of those students say they are not engaged in any activity outside of school. And so most kids are doing something. And this is the list of different activities that they are participating in. They're busy. You see that movies, sports, church, youth groups, different clubs that are our highest participation. So our kids are busy. And I make this point often about just because kids are doing something, that doesn't mean that they're not going to go engage in substance use for some reason. And I use the example of musicians and athletes. Tiger Woods just checked himself into a rehabilitation center last week, so that doesn't necessarily mean because they're engaged in an activity that they'll never use drugs or make unhealthy choices. So teaching them to cope with the stress and pressure of those activities is an addition to keeping them busy. So we also evaluated youth access to basic needs as it relates to substance use. So one of the questions we asked is how many days out of the last 30 have you had at least 2 meals every single day? So 33%, so a third of our kids in middle school and high school are not getting at least 2 meals per day. And the kids who are getting at least 2 meals per day, most of them, 60%, are not engaged in any substance use. So if they're hungry, if they're coping, if they're acting out because of they're hungry, they're gonna glue to that friend group that is vaping in the bathroom or find something else to do. And so we did not evaluate, so one thing to note about the food is we did not evaluate whether that was by choice or by availability. But just in other data that's around in southern West Virginia, I'm gonna go with availability. Hygiene, we have 12% of our kids do not practice proper hygiene. And so that was an evaluation of, do they have access to a shower, deodorant, to brush their teeth? Do they have access to those products? So 12% of our kids said no. And 76% of the kids who do have access are not engaged in any substance use. They're not vaping in the bathroom, no issues there. And then we evaluated hobbies. Now, in this question, it was worded as a hobby versus just an extracurricular activity. And in some instances, those things overlap. In other instances, they don't. Like, I enjoy doing puzzles in my hammock. So that's not necessarily considered an extracurricular activity. So we worded the question like that. And so 79% of the kids participated in at least one activity that they enjoyed. And so a little bit under half of the kids who have at least one hobby are not engaged in substance use. And so to circle back to the food, so a third of our students are not having 2 meals per day. So that's like 1,700 of our students. Assuming they have the one parent in the house, we're talking about 3,400 people are not eating at least 2 meals per day. That doesn't count any siblings or any homes with second parents. So 3,400 people needing 2 meals per day is about just under 7,000 meals per day total to feed the students who do not have food, or 48,000 meals per week, or 2.5 million meals per year. So when we talk about, well, everybody does food, and the limited supplies, and this person's doing this food, we're talking about trying to get 2.5 million meals in just Raleigh County. This is only Raleigh County, and these are only the kids who responded. And so the other thing we measured was youth access to support. So stress management, 58% of our kids admit that they are not managing their stress in a healthy manner. And 83% who do have healthy coping strategies are not engaged in substance use. 48% of our kids say that they do not have at least one trusted adult. Now, we worded that could be a parent, it could be a coach, community member, whoever. But so just under half of our kids admit that they do not have a trusted adult that they could go to about whatever stressful situations. And so the other part is that 72% of our kids with at least one trusted adult are not engaged in substance use. So we talk about the musicians and the athletes just a couple of minutes ago, and teaching kids how to effectively stress with pressure and stress. And so us as an adults, we take mental health days or days of like, I just don't want to do this, whatever you call it. So our kids don't have that option. There is a huge push for attendance in schools. And while yes, that is important, we need to teach our kids to also cope with attending school, the social pressures of all of that. And so trusted adults having access to somebody who supports them no matter what. I think I've seen memes and TikToks about there should be one adult obsessed with children, your child, who loves them unconditionally. So as we think about our own support groups, like the same person I call for a bad day is not the same person I call if my car is broken down on the side of the road, right? So our diverse support groups that circle around us as adults, kids need that too. And it doesn't necessarily have to be just their support groups inside their home. So we also asked for what activities youth want in their communities. And so through combing through this, because this came with a comment section, we discovered that kids just don't know what's going on here. So the largest piece of the pie here is outdoor activities. You can walk out the door and there can be an outdoor activity in any direction. So that tells me that the kids don't know that's happening. So that's us as adults, as people in charge, as leaders in running events, organizing activities for us to be able to target the kids. Sports opportunities for all players. I know that I've talked to a couple people in this room about that. And the other thing with these programs is that they exist, but they need volunteers. Right now I've seen YMCA is doing a big push for the need for volunteers to coach their new flag football league. So that is something that the kids are saying they want to happen, but in order for that to happen, we have to do that together as a community. So, and they're always looking for soccer coaches, but there's organizations that are like that too, that need volunteers in order for the activity to take place. So we also talked to them about why they are not participating. So time commitment and conflicts. There was a comment back with this one too. When everything happens either right after school or dead at night. I was just talking to Dr. Christy Dumas about our kids having track practice way too late tonight. Now I was at the baseball field after dark last night. So a lot of people have those time commitments, and I don't have the solution to all of these. I'm just telling y'all what the kids say. But time commitments, transportation, and we have kids, like 11% of the kids are like, we don't have any reason, we don't care. The information being unclear and unavailable. So when we talk about how we're getting information out to kids, I know that Facebook doesn't allow targeted ads for profiles that are underage, like our minors can't have targeted ads for them. So there has to be a different reason or a different way to get this information to our kids. Solutions. So access to basic needs, food, access to support, less of there is nothing to do and more is do they know what is available. Supportive evidence-based programs that already exist that address our peer-to-peer social skills so that we can close the gap on are my friends going to think that this is okay? So DARE, I know there's some controversy about how the DARE program works. I just want to make it clear that the updated DARE program is now coupled with an evidence-based curriculum called Keeping It Real. And as it's coupled with that curriculum, DARE is evidence-based, it is effective, it's less lecture and more role-playing with our students, having them in the front seat of their learning experience and allowing them to learn those social skills of setting boundaries. And it's targeted towards substance use. However, we all need to learn how to set boundaries. I'm gonna go set in a DARE program myself, so I can learn how to set boundaries with some fifth graders. Community in schools, our school counselors, other programs that are already intact in our community. Increasing education about the direct harm of substance use. It's clear that our kids do not think that there are any immediate or long-term harmful effects of engaging in this, whether it be from social, mental health, physical health. So doing better about getting that information out to them and getting our peer-to-peer support. So getting the kids who do understand that there are harmful effects and having them teach their peers. Enforcement of laws and policies that restrict access. So this is a big one. I feel like I'm all the time talking about we just need to enforce what we already have, which was a theme. If you watch the legislative session this year, they talked about enforcement a lot. We already have this law, it's already in place, it's not being enforced. So what do we do about enforcement? So making sure that the policies that we put in place are in place, we're following them, we're enforcing them, and holding people accountable, whether they're selling to our minors, whether parents are giving it to their kids, whatever it is that we're holding accountable to those policies. Working together and not separate, a coalition approach is it's synergetic. It's not this person over here doing this, it's that person over here doing this. It's, okay, this person is doing this, how do we wrap around them to make sure that they can do it as effective as possible? And sending a community-wide message that this is not tolerated. So from this list, don't everybody go out and be like, I'm gonna go get food for all the kids because we need 2.5 million meals. It's everybody working on these solutions together of what can I do, who's doing what, being organized and strategic about our approach, and making sure we're evaluating what's working, what's not, who's already doing it, who needs support, because we have people who are doing this work who are drowning. And so if we wrap around those folks and work towards a common goal, we can wipe this out. We can increase these numbers of parents who are disapproving, decrease the numbers of kids who are using. Like, we can totally do that. That is within our capacity as Raleigh County. Thank you. Any questions? It's a lot of numbers.
Jill? All that data, it's on a website, or do you have a Facebook post or something that needs to be shared? This was really informative.
Well, so we just got this data pulled out, so it will be on our website.
Good.
Yeah, and
Good, or a newspaper article, something needs to get out there. Yeah.
This was our introduction of this data. We just pulled this and finished up the surveys in January, so we just got it all together. So you guys are hearing it first. Congratulations.
Kelly, did the students indicate what their stressors were? I know one of the questions up there. What's stressing them? What's stressing the students?
So we gave a comment box for them to provide some information or some insight, but it was general. We have some who listed family issues and mental health. And for our middle school is hard. I have 2 middle school kids right now, and just middle school is just hard. And so navigating that, people who don't have support systems to wrap around those kids can make you feel alone or isolated and looking for an easy fix. So the brain development of our middle school and high schoolers is instant gratification. And they're looking for what's easy. I feel yucky. And so a hit of the vape or whatever is easy and it's quick. So teaching the skill of one, delayed gratification and coping would do wonders.
Kelly, you and I talk about this ad nauseum, and I'm a huge defender of there's not a lot to do. I leave town, I'm a city girl. I leave town to get a break from my agenda and Ross, my son's agenda in Beckley. I look at Beckley calendar of events and I get tired. So what ideas are there to get the word out about all that goes on in and around town? Because I could do something literally every night of the week if I wanted to. Same with my son. So what are ideas to really get the word out about what is going on around town and getting parents motivated enough to get their children involved? Because that's the connector. When I have my finger on the pulse of what's going on around town and I see that what the real issue is, you want a standing something, a jump house where you can drop your kid off and they can be there for 3 or 4 hours. What are some of the ideas that we can get going to really get parents involved to seek out some of the activities and the events that are already going on? And, no need to reinvent the wheel. How do we communicate that?
So 2 things. The first one's not going to be super popular. We can want parents to participate and be motivated until we're blue in the face, but we cannot make them be motivated. And so we need to work with the kids, direct line to the kids. And so we've had a lot of success. We use a platform called Project Broadcast, and it allows us to send mass text messages about things that we're doing, information, because that is how kids communicate. Their phone is in their hand. And so meeting them where they are is how we ended up using Project Broadcast. Just so that they could get that information. We have a way that they can sign up, they can opt in, they can opt out. But motivating grown adults who have their brain is fully developed is more difficult than motivating kids whose brains are not fully developed. They have that neuroplasticity that we can work with. It's easier to get them to be motivated, engaged in things, than it is to force parents to be involved. Agreed. Does that answer your question?
Agreed.
Andy.
Hey, kind of along those lines, recognizing the agency that every human being has at a young age as well as in adulthood. My question is about walk and bikeability. So the agency of a person to get somewhere without somebody having to drop them off. Do you feel like there's any evidence of from other communities that sort of point to opportunities here of better engagement with youth with some relatively simple fixes. I like to think of bike and pedestrian infrastructure as a low-hanging fruit. I talk about it a lot from the economic development standpoint, but the real driving factor in all that is engagement, is connecting people to their places, and especially recognizing patterns in rural areas like school consolidation, where the centers of residence and neighborhoods is not the same place where schools are located necessarily anymore. Churches as well, the fellowship halls and other places that are venues for activity. So taking all that into consideration, does that theme come up, connectivity?
So a couple things there. When we talked about earlier about individual focus strategies and environmental strategies, we can give the kids a bike to be able to access the YMCA or the bike trail, but that has to be a place that we know our kids are okay if they go do that by themselves. So the individual is that we provided them with the bike or whatever accessibility, but as a community, we need to have in place and enforce, emphasis on enforce, the policies that are in place so that the kids can do that. It's a two-prong. You can't do one without the other. But yes, connectivity and access proves to be a protective factor and keeping kids engaged and not engaged in substance use. Because there is something to be said for as long as our kids are busy, then they are not worried about engaging in substance use. There's more to that. But having access to that, 100%. I know Captain Liz has a group of kids who walk to the soup kitchen during days that there are no school. So them being able to walk and have access to that means that they have access to food. So 100%.
Great job, Kelly. Question about the data collection. I might have missed it because I came in late. I'm so sorry. But getting these surveys into the school, what were the number one barriers in collecting that data? Because we work with kids every day, and getting them to fill out a survey is like trying to teach a turtle to tie shoes. Like, it's very difficult. And so how are you able to, number one, get to where the kids are to get these surveys? And is it just public schools? Is it private schools? What was that selection process like?
Sure. So money drives everything. So we tried to engage the private schools. The private schools were not interested in the incentive, so we did not get any information from our private schools. We had one high school that did not participate at all, or one middle school, I'm sorry. Otherwise, everybody else was really motivated by the incentive to be able to do whatever project it was. So some had it to provide resources to kids. I think they brought like socks and leggings. The other ones used it for like project graduation to be able to buy bigger prizes to be able, which is a prevention strategy. So it was really driven by the schools being motivated. And so teachers, we have one school that had 100% participation, and they were, everybody there was excited. They wanted this information, they're engaged in the coalition, and so they saw the impact and the purpose of having this information, so they were all excited, and so when they're excited, the kids were excited.
Thank you. Any other questions? All right. Well, Kelly, thank you so much for sharing that data with us. It's really amazing when you talk to the leaders today and the elected officials, they all say that they're doing this for the future of their children and their grandchildren. That's why they're running for office. That's why they are interested in economic development. And I think that you provided that other piece for us that's so important to consider as we talk about all the issues for West Virginia. So thank you.